everyone, I'm Dr. Margaret Isima Ojahire, a consultant psychiatrist and founder of Miotic Minders Health Services. I'm happy to speak on a topic that is very pertinent and relevant for our present realities, and one that I'm very passionate about: mental health. Some may wonder, why a psychiatrist? Why are we talking about mental health? After all, you're all professionals who are respected in your fields and functioning relatively well too. That I acknowledge and respect. But I'd like to mention that conversations around mental health is not exclusive to a particular group or to those who are symptomatic. Mental health is invaluable to all, regardless of one's status, and you may never know when or where you will need it or who it will be helpful for. Unfortunately, conversations around mental health are mostly neglected and hushed among professionals because of largely stigma and poor awareness, and the focus has been on physical and social health. Mind you, I'm not saying that physical and social health that promote healthy diet, exercising, going for regular checkups, taking prescribed medications, and ensuring healthy connections are not necessary. On the contrary, these are all very beneficial for overall health. But attention to mental health needs to take a front burner. Statistics demonstrate that 1 in 4 to 5 persons will experience mental health problems at some point in time in their lives. Similarly, the Nigerian Survey of Mental Health and Well-being found that most mental health disorders are mild. What that implies is that mild to moderate forms of mental illness or mental health disorders may not be easily recognized, and if left unattended may result in several severe forms that eventually get stigmatized and are disdained. Common mental health conditions include depression, anxiety, mood disorders, psychosis, substance use disorders, dementia, childhood conditions such as attention deficit, hyperactivity disorder, and autism spectrum disorder, just to mention a few. Likewise, these disorders are characterized by a gamut of symptoms such as eating too much or eating too less, sleeping too much or sleeping too less, changes in mood feelings, either you're feeling sad or duly excited, loss of interest in things previously enjoyed, withdrawal from friends and activities one used to enjoy, hearing, seeing, or sensing things that are alien to others, unexplained body aches, poor concentration, memory problems, and it goes on and on. So the question is, why should mental health be a topic for women professionals, particularly architects? Generally, the average Nigerian employee experiences high levels of psychosocial stress, which is a risk factor for mental disorders. There are studies that suggest that high levels are also found among professionals, particularly architects. Women are also more susceptible to mental health conditions. Studies show that 1 in 5 persons will have mental disorder, and women are twice as likely to experience depression and anxiety as men, and higher likelihoods of having eating disorders and post-traumatic stress disorders and other stress-related mental health problems. It doesn't help that increasing socioeconomic factors put women at risk of mental disorders. And there's also the increased likelihood of women being more vulnerable to the influences of childhood trauma and exposed to high levels of sexual violence. Yes, there are cases of men experiencing gender-based violence, but we know that women are usually at the receiving end. Hormonal changes also that women experience during phases of their life, such as menses, pregnancy, menopause, also predispose them to mental health conditions. And then there's the women in the middle phenomenon, which encompasses women with emotional burden of family life and predisposes them to mental health problems. Again, we can now ask, why should women professionals, or what should women professionals do to ensure healthy mental states? It is important to reiterate that you can't give what you don't have. So it's important that if you're going to support women, if you're going to help people, then you have to ensure that your own mental health is intact. So female architects should look out for themselves and prioritize their self-care. I usually like to summarize it with the 5 L's. That's the learn, the look, the listen, the lift, and the link. In prioritizing your self-care, you need to learn about mental health conditions. And I must commend the organizers of this initiative. They've done a lot in pushing this to the front, mental health conditions. Because it's important that we need to know, increase our knowledge base so that we can identify symptoms whenever and if they ever show up. Let's avoid overcommitment. Let's learn to say no. Overcommitment is a sure line to psychosocial stress and invariably burnout. Let's learn to take breaks. It doesn't have to be an expensive one. You don't have to travel out. You don't have to travel to Budu Ranch. You can just take, it can be in your house. Just arrange it and enjoy the moment. Just ensure that we get enough sufficient sleep time and eat healthy. Exercise is also good. You don't have to register in a gym. You can be in your parlor. You can dance. Release those happy hormones, which are very helpful for good mental health. And then look out for symptoms. What are the red flags? What are those warning flags? How am I doing? Ask yourself, is there any